Welcome to this episode of the NLN podcast, Nursing Edge Unscripted, the surface track, and thank you for joining us. This episode is entitled Basecamp, Acclimating Interprofessional Teams to Overcome the Impossible. And to help us today, we have two very special guests, Dr. Kevin Ching and Ms. Kathryn Muccino. Dr. Ching is an associate professor in emergency medicine and pediatrics at Weill Cornell Medical College and an attending in the division of Pediatric Emergency Medicine at New York Presbyterian Hospital, where he also serves as the medical director for the Simulation Center. As director, Dr. Ching oversees the development and implementation of multidisciplinary teaching programs in simulation for residents, faculty, and medical students. He's actively engaged in simulation research on the role of human factors in pediatric emergencies, procedural skills, success and retention, and the effect of simulation on patient outcomes. In addition, Dr. Ching is the co-founder and chair of Basecamp, an annual multi-institutional, multidisciplinary conference using simulation models to introduce, review, and practice teamwork, crisis resource management, and emergency resuscitation procedures. Kathryn Muccino is a nurse practitioner at Shriners Children's Boston, with a specialty area in burn surgery. Kathryn has a dual master's degree in healthcare and business and diverse professional experience in clinical provision and operational efficiency, educative processes, and curriculum development, policy, and accreditation procedures. She also seeks to utilize clinical expertise within an innovative, operational, and strategic healthcare position. Kathryn has been co-directing the Basecamp experience with her colleague, Dr. Ching, for 13 years. I also want to just add, as we get started with this episode, that I had the privilege to participate as a faculty in the annual Basecamp experience in November of this year. It was by far the most influential simulation learning experience I have experienced that brought me right to the edge of my comfort zone as a teacher, a nurse, and honestly, as a parent. It was at this edge that I was able to experience what Rachel and I always talk about, this desirable difficulty, this willingness to lean into discomfort in the service of learning. This invigorating and slightly uncomfortable place is where memorable and transformational learning occurs, and I'm grateful to have experienced it. So let's jump into our conversation to learn more about Basecamp. Welcome, Kevin and Kathryn.
So Kathryn, Kevin, it is so great to have you here on this podcast episode. You know, the first time Michelle and I spoke after she came back with her experience with you all, she was like, Rachel, I have to tell you about this. This was the most transformative, amazing experience. She's like trying to rope me into future experiences. And I just couldn't wait to hear more about it. So I want to kick it out to you all to share with us what is Basecamp, what it's about, help us understand this magic and such a transformative experience.
Well, thank you for having us. And you are welcome to all future base camps. I'm sure Kevin will agree.
Absolutely. I'm 100% on board with Kathryn's invitation.
Thank you. So tell us more about Basecamp and how it got started.
So Basecamp started about 13 years ago in 2010. It was born out of a need to find a way for nurses and pediatric emergency medicine fellows, new physicians, to work together. We saw that, how nurses and pediatric emergency medicine fellows were trained and expected to, really quickly assess critically ill and injured kids. And at the same time, you have to provide like these emergency medicine resuscitation measures. And I was a new attending at the time. And, we looked all around us and we said, this is a really fast-paced environment. And we expect that, these fellows who I was only just a few years removed from had to really quickly step into their new roles and have like competencies in critical behaviors and skills and somehow provide like very safe and effective high quality care. At the time, I was working at NYU in Bellevue Hospital, and we had a whole slew of new team members, not only fellows, but nurses. And so it got us thinking, the first, first inspiration came from when we thought about ourselves, again, as new, I should say that we were all new attendings. We were like a crop of sort of young recruits. And we remembered that, when we were residents, that the truth was, the opportunities to experience and practice many of these sort of very high acuity, low frequency events were, limited. And, of course, that's the reason we have medical simulation, right? Healthcare simulation is born out of that need. But we also remembered that, truth be told, even combining together our real clinical experiences with those from our simulated education training, it was still very sparse. The American College of Graduate Medical Education for fellows requires only 4 months of acute and emergency care training, like in all 3 years of residency. That's not a lot. I mean, it's entirely likely that you graduate like I did from residency without ever caring for someone who's in cardiopulmonary arrest or like put a chest tube in, and this is the thing that really struck us. I never led a team when I was a resident. And so suddenly I became a fellow, and I had remembered people expected me to somehow lead this team, and I didn't have the training or the experiences. And so, again, as colleagues, we looked around us and, there was a whole team of new nurses, fellows, and we got to thinking, what could we do to sort of like bridge the gap between the expectations of us and like what we were capable of doing? And that's when we thought of creating Basecamp. Now, there was an inspiration for Basecamp. There's a pediatric critical care boot camp that is in CHOP, Children's Hospital of Philadelphia. And at that time, they had been around for a few years. And that boot camp was focused on pediatric critical care fellow training. So it was a 2-day intensive course based on what fellows needed to become proficient critical care intensivists. And, we saw that as being inspirational, but we also wanted to challenge ourselves to sort of think about like how fellows as physicians really are codependent on how as an interprofessional team, like we all work together, like all resuscitations it's like a team-based sport, right? And so, I don't need to preach to the choir, but that's where we got the idea that we would create this interprofessional, high-impact, learner-centered program that was, at the time, really focused on interprofessional teamwork, advanced life support resuscitation, advanced airway resuscitation, trauma resuscitation, and very importantly, the cherry on top was that we thought about mass casualty incident disasters. And I remember that mass casualty incident disasters was a addition to Basecamp, the cherry on top, if you will, because we had a quintessential school bus that rolls into the ER, right? The quintessential, what do you do when a school bus rolls into the ER with like whatever number of kids? And I do remember that day because we were given a notification. We were told that there was going to be this like bus full of kids that I don't even remember what the issue was. I think it was probably some accident. And we started getting prepared. And it was painfully apparent that we were all on different pages about like what was necessary in order to sort of work together. And So again, that was another different inspiration for the addition of mass casualty incident disaster training to Basecamp. And it has a very special place in the instructional design of the program.
That's great, Kevin. I'm wondering if you can actually describe the instructional design of the program briefly, walking through some of the highlights of the different events that occur throughout the weekend to give our listeners a little bit of an understanding of what it might be like.
Sure. So in many ways, there are three phases to the instructional design of Basecamp. It starts with a pre-conference cognitive load. So in this stepwise sequential model of learning, it begins with sort of this idea that even before any of the nurses or fellows and now child life specialists come to Basecamp, there's an expectation that they come prepared. And we want everyone to have a shared mental model before they arrive, because it sort of elevates the sort of practice of everyone around them. And so when we started, the idea was that we were trying to foster more purposeful learning. We wanted deeper engagement at Basecamp. And so these pre-conference sort of educational modules, which, to be honest, after COVID, it now seems like, asynchronous learning is like the, sort of way to go. For us, it was trying to get people to develop like declarative knowledge. And, we customized all these modules, which included something that was dear to me, which is I have a very short attention span. And so, they're all sort of like, high quality graphics with very little text. It's just basically very high yield information. Many of them have multiple choice self-assessment questions, and they're tailored to stimulate self-directed learning and self-appraisal. And so, if you have an advanced opportunity to sort of learn these things, appraise what you do know or what you need to know more, then by the time you get to Basecamp, you can explore those topics in greater detail in a way that sort of makes sense to each learner. And then there's a side effect of that, and something that both Kathryn and I hold dear, and that is it eliminates lectures. And neither of us like, podium style lecture learning. And so, yeah, what it does is it gives more time for hands-on experiential like practice and learning, more time for simulation at Basecamp. And so, in that stepwise sequential model of learning that begins sort of before Basecamp, like when people arrive, when the nurses, child life specialists, and fellows arrive, and they're suddenly thrust into working together on these interprofessional teams, they hit the ground running. And, we have multiple opportunities in what's essentially an integrative and like experimental phase where, people get to practice those skills, right? And so we always talk about like deliberate practice. And, a very smart friend of mine used to always criticize when the deliberate practice is invoked and said, well, people always think of it as just repetitive practice, but deliberate practice really needs to be something that has a goal in mind, right? And you have to know what your own goal is. And that's where that self-appraisal comes with those pre-conference modules. And then there has to be some targeted feedback towards that goal, which is why, again, we try very hard not to have lectures at Basecamp so that people have faculty who provide guided mentorship and best practices rather than having to provide little mini lectures. And so, in this, second phase in the sequential stepwise model, the nurses, the child life specialists, the fellows get to practice different sort of like skills and behaviors, whether it's teamwork, airway resuscitation, trauma skills, et cetera, communication skills. And then they get to integrate that into the many simulations that we have, right? These are sort of like, high fidelity, immersive, theater-based sort of simulations. Kathryn and I work very hard to try to make them as authentic as possible so that people feel like they're really in their own sort of environment. The hope is that, people get to sort of put all of those skills, those behaviors into practice and experiment with them. And, one of the sort of worries that someone had shared with us, years ago when we first started Basecamp was that, you learn something in a high impact program and then you promptly just, a week later, you forget it. And so, as Kathryn and I have developed the program iteratively over the years, it's been important for us to sort of provide opportunities for reinforcement. And that's why it's a very long 2 days. We're not shy about telling all the participants before they come that, be ready. These are long 2 days. But it's those opportunities for reinforcement that are intended to sort of, stave off that sort of like decay or decline in like how people sort of think about like these skills. And we've studied some of them. And so, we know that this model works. The final stage in this stepwise sequential model learning is where we get to that mass casualty, right? And so that's the sort of like opportunity to consolidate, everything that everyone's worked on all weekend, whether it's, teamwork, trauma resuscitation, mass casualty, triage, everybody brings something different to the table. And it's squarely in the autonomous phase, right? Like this is a crazy event where like all heck breaks loose as a mass shooting. And people are expected to sort of call upon all of those experiences and practice the rehearsals that they've had all weekend, and put it into use. And it's the end of the weekend, and the idea is to have people leave having demonstrated best practices, so that they can return to their home institutions, wherever that may be, and share what they have like successfully learned, with a larger network of providers elsewhere.
I have a lot of things running for me. I think this is a phenomenal program. A couple of the things that are coming to mind as you're sharing this with us. One, I think you've articulated beautifully how to set up a program that identifies a gap in knowledge and skills among an interdisciplinary group and be able to scaffold the learning process in a way that translates to long-term retention and application of those skills. And the second thing that is running for me is you spoke to our educator heart when I hear you say, we want to move away from the lectures and we do these high impact, high yield, short bursts of content or knowledge so that we can get folks on the same page. And I think that's so important for our listeners to hear, because I think there's pockets, and particularly in nursing education, where they think if they're going to dive into interdisciplinary or interprofessional education, that they have to create these long lectures or content delivery so that everyone's on the same page and has a shared mental model. And that's just not necessary. And I think you've demonstrated that really well. So I appreciate you sharing that. And then finally, I really want to touch on this mass casualty event, if you don't mind, and go there for a second, because, when Michelle was painting this picture for me when we first talked after she came back, just hearing it was, one, impressive, the amount of psychological fidelity that you all were able to build into this experience and how activating it would be emotionally and replicate that. And I may have just been in the throes of, the postpartum hormones of having, a newborn at home, but I'm hearing this thinking, man, if I was one of those debriefers, holy smokes, how would I have responded? And how would I have balanced my own emotional activation with the task of debriefing this interprofessional group? And so while our listeners may not always be doing mass casualty simulations, I think that they are a lot of times debriefing simulations that are activating in some way to learners, to debriefers, or both. And so I just wanted to ask both you and Kathryn, what experience, if any, have you had with helping support your debriefers in navigating those waters of their own personal activation in a really high psychological fidelity experience, and not only managing themselves, but managing that interprofessional group?
Those are really great points, Rachel. Thank you so much for sharing them. Something that, and I'm going to touch on this, something that I met Kevin in the ER at Cornell, at New York Presbyterian Cornell. I was a nurse practitioner there, and that was the first nurse practitioner job I ever took. And I was the first and only nurse practitioner in the ER. And so it was a wild experience to go from bedside nursing to a new nurse practitioner and be the only one without any kind of support. And the attendings didn't necessarily know what my role was, and I didn't necessarily know what my role was. And as I fell into that, it was really great to have such wonderful attendings and wonderful nurses be able to support on both sides, but I still felt like this little peg in the middle. And I saw the nursing side and I saw the attending side. And so being able to blend working as a provider, but also working at the bedside was something that's really nice to being a nurse practitioner and having worked in nursing. And I think that is something that I get to see both sides of at base camp. And I love the collaborative feel, and I love the interdisciplinary feel, because there's so much support and everybody brings something unique, and you can see the professional growth of all the different roles that come: nursing, child life, and the physicians, the fellows. And so as this mass casualty has been developed over the years, you're 100% right. And I feel like even as the frequency of these events has happened, and we're a day away from the anniversary of Sandy Hook yesterday, these events are more frequent, and they're scary, and they're real, and they're in more common settings. And so being able to support the staff for these events that really can occur anywhere that you can imagine is hugely important. And I think that having all of the disciplines present, nursing, child life, and the physicians, is hugely impactful to that. And in fact, this year, there were a host of emotions that happened during some of the debriefing periods. There was crying, there was a lot of conversation. And I think that the professionals that we bring in are so, they have been with Basecamp forever. They love this experience. As Kevin said, it's 2 intensive days, and there's a ton of time to collaborate, to talk, to get together. And I feel like everything kind of stays in Basecamp, and you are immersed, Michelle, as you can probably imagine, in this experience. And so it just feels like this overwhelmingly supportive weekend where you get to talk about what you do for a living and how passionate you are about it, and you feel safe in that space. And we make it very clear that what happens at Basecamp stays at Basecamp, and we want to support each other, and whatever you need, we're there. We want to provide the resources that you need if you need somebody to talk to. But there is that inherent trust and passion and desire to support that happens so organically while you're there, that you feel supported. You feel that you can express those emotions. And being a mom that was postpartum a month before Basecamp happened, I get that. And you feel all of those emotions. And I think that we have such a wonderful group of faculty, volunteer faculty that do this, that come back year after year because they love it. And a lot of those faculty are fellows that have graduated from the program, or nurses that have graduated that come back every year because it's so wonderful, and because you see the impact that it has on others, that I just think that organic support happens without even really having to talk about it. But I do think that throughout the weekend, and the pediatric emergency medicine world is small, I feel like those conversations continue. And so the trust in those relationships, once it's cultivated that weekend, it maintains itself. And so the environment that we create kind of gets carried around in little pockets where everybody goes, in the world, and it comes back. And you really see, not just through the education that's being put out there, the impact that you can have, but also like exactly you touched to the professional network that you have, where everybody feels safe and supported and collaborative. I don't know if that touched on exactly what you were looking for, but that part of that emotion that continues to come back year after year, I feel like is what continues to draw people back, because it is such a dynamic, unique experience. It's not just a normal conference with lectures and simulations. It's truly this personal experience, and you get that touch. And what I'm so proud of is, as the size grows, that personal touch never leaves. I feel like it only gets bigger, and that's rare in many things in life. As things grow, and multiply, you lose that sense. But I feel like that only gets bigger for our Basecamp family. And I love that we can continue to share that with people, that participants that come year after year, and faculty.
Kathryn, since this was my first time attending, I arrived as a nurse and as a teacher that's experienced in debriefing. However, I was really challenged in that I don't have very little, almost none, zero content knowledge around pediatric emergency medicine. So I was novice to that. And then I was also very novice to debriefing a mass casualty simulation like that. I had done it maybe one other time, but it was a much smaller scale. So I very intentionally took sort of more of an observational role, being it was my first time in debriefing that mass casualty simulation, and let a experienced physician and debriefer take the lead. And I will be eternally grateful for what I had learned from her. Samreen is her name, and she was a breath of fresh air and a beautiful debriefer. And she opened the debriefing by starting with a meditation, like a visualization type of meditation. And it wasn't like weird and foo-foo. It was the most important, most needed intervention at that time, that words really would not have done the service that just a moment of getting into your body and you're finding your breath and kind of letting those emotions sort of surface a little bit and be present and be felt and be supported with the group collectively. And she just did this beautiful job of just visualizing a peaceful place. And so my point is like, it just helped. There's so many different ways to debrief and so many different styles and methods of teaching effectively, but to be able to learn from somebody in that way, interprofessionally, to learn just a really, really different way of acknowledging the need of the group in that moment, was just such a gift to me. And I was so grateful to be a part of that and to see that. And now I can take that skill, with me into my practice, and be able to implement that in a different way. So I think that was one example that I saw where the emotional needs of the group were met in the moment, and using very different ways of teaching and engaging.
The weekend is very busy and packed with many different simulations and activities. And I work very closely with our child life director, Hillary Woodward. And I have to say that I have learned a tremendous amount from collaborating with her, as I have with Kevin. Obviously, he's like my mentor for life. But just some of the unique modalities that she shared, exactly what you're speaking to, for debriefing and emotional support, and just the way she asks questions. The way that the weekend is structured and purposefully is it really resonates and it sticks with you, as Kevin has touched upon. Just like you're saying, that's a piece that you're going to take away. And I think that's what happens, is everybody takes those little pieces away and everybody leaves bigger and stronger and more dynamic because of it. And so it's just everybody so organically brings those pieces back that they continue to share and grow upon them. Exactly what you're speaking to. Yeah.
We want to be conscious of our time boundaries. This conversation could go on, and it will. We will pick up with our conversation with Kevin and Kathryn discussing the immersive and interprofessional simulation experiences of Basecamp. We hope you join us next time with the Nursing Edge Unscripted Surface podcast.
Thank you for joining us on this episode of NLN Nursing Edge Unscripted Surface. We hope you join us next time. Until then, remember, whether your water is calm or choppy, stay connected, get vulnerable, and dare to go beneath the surface.